Medical personnel and emergency crews are on the front lines of the fight against the coronavirus.
The CDC is loosening guidelines for healthcare workers who've been exposed to the virus. CBS 17's Mackenzie Stasko is live tonight in Raleigh. And Mackenzie, not all nurses and doctors think that's the right call.
Yeah, Marius, that's right. As cases of COVID-19 increase, as we get a surge in those cases, that could mean there could be a short supply of protective gear. And if it does reach that point, the CDC is now saying that workers should rely and resort to scarves and bandanas to protect themselves. Healthcare workers we spoke to are now concerned for their own health.
That is not appropriate respiratory protection. We need to have equipment that has been tested, and bandanas have not been tested.
Those last resort guidelines from the CDC are alarming to nurses like Ashley Leake Bryant. She works here in the Triangle and is an associate professor at UNC's School of Nursing. Bryant wants to be clear, her opinion is her own and not reflective of the school's overall thoughts. She tells me she hasn't treated anyone with COVID-19 yet, but knows that could change at any moment.
There's an overwhelming feeling because things are changing rapidly, really every hour and every day.
Do you feel as though healthcare professionals are being put at risk?
That's a great question. I would say it varies, but I would say that most people are doing the best they can with what they have.
The CDC now also suggesting hospital workers who've briefly been exposed to the virus keep working. Just wear a mask. Earlier guidelines were to quarantine for 14 days.
And so what's going to happen is it's going to be a domino effect. Everyone is going to be out of work then, right? Because then if I'm exposed, I'm going to come to work and expose you and the others that work with these patients. And that is not what we want at all.
With insufficient protection, hospital workers on the front lines worry they could become a patient themselves.
There's a lot of questions that we could really look back and say what we could have done differently, but I think in the present moment, we really have to move forward with what we have now.
And the American Nurses Association says putting those on the front line without protective equipment will not only make their jobs more difficult and more dangerous, but will ultimately lead to more deaths here in the United States. They're calling for an increase of production and are even asking construction companies to donate any extra masks they may have to hospitals in need. Live in Raleigh, Mackenzie Stasko, CBS 17 News.